Right.
Hi, my name is Tanya from Power Pantaloons, and this is my co-host, Jennifer Ajla, and I'm not going to pronounce the other one. She can.
Jennifer Foliadojla from Caregiver Carekit.
And today we're presenting to you medical binders. Apparently, this is a fantastic tool to use, and I'm going to drop the link in the chat so that everybody can download it and print it off. And then we're going to talk about why it's important. Go ahead, Jennifer. You could start this off.
Oh, thank you so much. Um, yeah, so medical binders. When my children were little and were experiencing some learning disability problems, they became my lifeline. So every time they went to a doctor or a specialist or a health professional or a physiotherapy, I took a copy of what they gave me and I put it into a medical binder. I also put all their school stuff into a medical binder and anything else that I thought was imperative to um, the next person that might be helping them along. So whether it was a teacher or my husband or a friend, the binder always went with them. So it became a source of information that we could communicate between one person and another person. And over the years, the medical binders got, this is my daughter's, quite thick and quite big, but that was over, 12 years of school and so forth. But now that they are adults, my children can take their binders with them. And instead of trying to remember what mom said about what happened 15 years ago, all of that information is in their binder. And so just recently, my daughter had taken her binder to a professional, and the professional said to her, "Tell your mom this is one of the best organized binders I've ever seen." She could go exactly where she needed to go to get the information she needed at the tip of her fingers. And so that's kind of what a medical binder is all about. It's it's just a place to store information about either yourself or your loved one, so that all the information is right there at your fingertips for whomever might need to know that information. So that's kind of the overhead picture of what a medical binder is. Tanya?
When I was diagnosed with a carcinosarcoma of the uterus back in 2007, I was told lots of things. And one of the things that was strong on that was chemo brain. You're going to forget stuff. You're not going to know who people are. You're not going to know anything. You're going to live in a fog. So I decided that that wasn't going to work for me. So I called it my portable brain, and it went with me everywhere because even before that I had memory issues. So having a spot where I can put everything, it was just, and this was, I'm old. This was before cell phones were a big deal, right? Like, and I'm old school. I like to have it in physical form. So that's mine now, right? Like, I don't know. No, we can't see it. This is mine now, and it's 3 inches, and it has tabs in it. It has folders in it. I got a couple of those beautiful plastic vinyl pouches that close for things like imaging discs and stuff like that. This can become a a gold mine for you every time you go to a provider or doctor, have a surgery, have blood work, so that you can actually see what's going on with yourself. And you can look at your blood work and you can see over the years how things are going. And you can have a baseline when you go to get tested for something. Do it early in your life, right? If you can. And that way, if something's off with it, you already have a report in your beautiful binder that talks about that so that your new doctor, because you had four in the meantime, right, can see exactly, because insurance companies don't keep your medical records longer than 7 years, maybe 10 if you're lucky. And that's if you even have insurance. Not everybody has that luxury. So this is a thing that really kept my poop together while I was going from appointment to appointment. In what you're receiving is your emergency contact list, your medication list, which can change, right? So anytime you need a new form, just print out another one. A couple of providers. What else is in it? Let me look at it real quick, right? Emergency contact list, your medication list, your immunization history, your insurance and pharmacy list, an appointment tracker. An appointment tracker is very helpful because then you can have everything all in one spot. So you can be like, I went to this doctor on this date, and then I went to this specialist over here, and then I had this lab work done over here. And then you're going to want to keep those things separately. So you have all of your lab work over here and all of your general practitioner stuff over here. And if you have ortho, it's over in this spot. And then we have family medical history. And while for me, like I'm going to talk about cancer a lot because that drives why I help people. Only 5 to 8% of cancers are actually genetic. The rest of it is toxicity based. However, it's still important to know if Aunt Jody had breast cancer or Uncle Bill had prostate cancer so that you have that information, or heart disease, or whatever it is. So I have one that has stuff in it, and then I have a blank one so that you can fill in stuff that might not be on that. And then it goes over your healthcare providers and then your facility providers. So that's a good start for you. You can also put in things like surgeries, your lab works. Those pages are coming along later. I haven't built them yet. Does anybody have any questions at this point? No? Okay.
I just
Fantastic.
say that it's perfect for me because I have 3 kids and I have hard time keeping up with everything, appointments, and I always have to look for the insurance cards. And even for a field trip yesterday, I had to fill up some information. I was going through my wallet for like 30 minutes looking for different things for the different children. And then another thing, I keep the prescriptions of the antibiotics and everything that they use through the life because I want to have it in case that once again I need them, or I know what they already took before when they were with certain, when they had the flu, what did they take? Because like my daughter, it's allergic to certain medications, so I wanted to make sure we don't get it again, and warn the doctor in advance and everything. So instead of having all these prescriptions with me, like I have folders and folders, I can just fill up this form. So I just wanted to say thank you.
You're welcome, Stella. You make an excellent point. And because you have younger children, starting a binder for each of them and then just photocopying the insurance card and sticking it in there. And then when
Yeah.
you have field trips, you can just look at your medication list or your allergy list, because
Mm-hmm.
that's a page I'm building because it needs to be in there. Like
Like you make it
medicines,
so much easier for me. Thank you.
yes, exactly. And all you have to do is just grab the one for that child anytime you need to fill out a form. Schools require immunization list, or they did. I don't know if they still do. I'm old. Um, so it's a way to track that, and it's a way for your kid to have it later on in life and know exactly what procedures they had. Because if I'm asking my mom at this point, she's in her 70s, I'm asking her about procedures I had when I was 5, she's not going to remember. So this is a beautiful tool that you can gift to them. Yeah.
And
Any
like,
other questions?
for example, for like the pharmacy phone number and everything, instead of every time me Googling, what was the Walmart pharmacy next to me, phone number and everything, I can just fill it up in there.
Yes, absolutely. That is the entire point. And you can get yourself one of those pouches that I was talking about, and you can put things in it. If you want to take the labels off the prescription bottles, you could do that. If you want to just put insurance cards in there, or you want to put, when you go get MRIs or you go get CAT scans, they're now just putting them on CD-ROMs, and you can just stick them straight in there. My binder's got actual images from a mammogram that I had 7 years after I was diagnosed with cancer, and we there was a thing, so I had a little scare. So I have all those images, which is kind of ridiculous, but I have them. So I want them on the CD-ROM. It's just easier.
Of course. So I come at it from a caregiver's point of view. So a caregiver will include your spouse or a friend or a relative, any of those. But of course, Stella, you are the caregiver. You're their parent, but you are a caregiver to your children. And so similar to Tanya's, but a little bit different. The package that I have for you guys, which I'll give to you at the end, has all the personal information, but it also has medical records, places to ask questions to the doctor. Even though you would be there with your children, once they hit legal age in the US is 21, you don't necessarily get to go to their appointments with them. Here in Canada, in Alberta, the legal age is 18. So
The
my
the legal
children,
the legal age here is 18. However, there are certain procedures where you don't have to have your adult in the room because of domestic violence laws and stuff like that. So young ladies have gynecological visits without their adult, I think, at the age of 12.
oh, that wouldn't fly here. At 18, it does. So when you have a child that has issues, and you're not allowed to be in the doctor's office anymore, that can be, and I understand it and I uphold it. It's a confidentiality thing, and I'm good with that. But I need to get my message across to the doctor about medications, allergies, um, any information that he might require. So there's pages in here to ask questions to the doctor and then have the doctor respond to you. There's also appointment trackers. But the other thing that's in mine is what we call caregiver to caregiver. So that may look like you are going away on a holiday with your spouse, and you're leaving your children in the care of someone else, like a family member or so forth. And all the information is in your binder so that if anything should happen, even a cough, cold that gets out of control, all their allergies, all their care, all their prior care is at the doctor's fingertips, or if they have to go to the hospital where they're seeing a doctor that doesn't know you. This also extends to any person who may, for some reason, even though they have their spouse with them, may for some reason not be able to speak for themselves. They have pneumonia and they just can't breathe and speak at the same time. So instead of relying on your memory about things, all of that stuff is in the binder. Caregiver to caregiver could mean um, family. So, you're leaving somebody for respite with a family member or a friend, but it can also mean, trying to um, get a teacher or your school to understand that there's been a change with your child or your teenager, your young adult, um, and they need to have written instructions on what's happening here. So it can look like many things. It's not static. It can be used for a lot of different things. But Tanya made a really good point about cell phones. And I just wanted to come back to that because cell phones are a wonderful thing. But if you have even a mini version of the stuff that we're going to give to you today and throw it in your car, unless you have what they call ICE on your phone and have it filled out, if an emergency responder cannot access your phone, or if it's damaged and they cannot access it, and you are on a myriad of prescriptions and blood thinners and so forth, where giving you something in an emergency situation can cause complications if you're taking certain drugs, having your book or your it doesn't have to be a binder, it could just be a small like notebook that you put stuff in, duotang I believe they're called, can be a life-saving thing for an emergency responder to be able to go, hey, look, there's a medical thing in here and his name is on it, and flip through it. I'm not talking about really personal information, but I am talking about life-saving information, what you're taking currently, whether you have uh, certain ailments that you're not wearing, excuse me, bracelet, medical bracelet for, any of those things. That can all be just if you slide it between the seat, so the top of it's out. If you're in an accident, if you can't speak for yourself, if you've had a medical emergency while you're driving, all of those things can be right at somebody's fingertips to provide you with the best care possible. So it really isn't just about one certain thing. It can be used for a myriad of uh, different types of incidents that could happen. And at the end of the day, it's just all your information for you in one spot. And then
Yes,
further down the line, we get into, when we start adding things like advanced planning and so forth, so that your family knows where to go at the time, or just for you to know that everything's where it's supposed to be and somebody knows where it is.
absolutely. To Jennifer's point, if you're having a medical emergency in your house, the EMTs are not going to go hunting for medical information. So if you have a one sheet on your refrigerator, I'm allergic to heparin. So if I would put that on my refrigerator that I'm allergic to heparin, and so they won't give me that, anticoagulant drug. They'll find some other way to make that a thing if that's something I require. Making it easy for the people that give you emergency care makes it better for you, right? Like you're protecting yourself in the long run.
Yeah.
And Jennifer was talking about advanced directives. That is definitely something you should put in this book. If you don't want to be resuscitated or intubated, you should get your DNR and your DNI filled out and just stick it in there. You should put in a copy of your medical POA so they have contact to that person so they can find that. Stick that on your refrigerator as well. If I'm incapacitated, this is the person that's allowed to make decisions for me. They will absolutely look on your refrigerator. I've seen EMTs talk about it on TikTok. They're like, this is the only place we'll look. We have no time for anything else. So that's a good start there. So it's a beautiful tool for you in so many different facets, whether it's a scheduled appointment or an unscheduled appointment, especially if you have a complicated medical history. And anybody that's got chronic conditions or any of that has complicated medical history. And Jennifer also touched on the being able to bring the binder to class and things, not class, listen to me, I'm being ridiculous, to your doctor. So if you're seeing a new doctor, right, and you have a condition and you're young, and it's not necessarily a condition that young people traditionally have, having your medical records with you to present to them gives you authority and legitimizes the fact that you've gone through this stuff, and you don't have to explain to another provider that you've done 10 years of testing, and that you don't want to have to redo it, that you'd like to start where you're at instead of going backwards. A lot of not white men have issues with certain doctors because the doctors don't necessarily listen to them, whether it is the first time you walk into the doctor and you live in a larger body, that instead of addressing your concerns, they're like, well, lose some weight, that'll clear that up. Having this kind of a tool for you will hopefully lessen that kind of garbage. And then, of course, advocating for yourself, which is a soapbox I will stand on and just chat about all day long. If you think something's going on with yourself, advocate for yourself. That is literally the only reason that I am still here. When I was diagnosed, they actually had to do a D&C to find my cancer. There was no markers in my blood. My pap smear, the ultrasound, the sonohistogram, all of that stuff came back negative or inconclusive. And when they took out my uterus, it was still over 10 pounds of cancer. So when your body tells you something, fight for yourself. Fortunately for me, I had a doctor that listened to me. One of the things that you can put in your binder is you can track your symptoms when you're having differences. Like, your body, if you're normally regular and then suddenly you're pooping 4 times a day, that's a change. That might be something you need to address. But if you're also keeping a food log and an activity log, you can see if you've changed things that might cause that. This is like having KPIs, indicate, like, you can build systems to help track what's going on with you so that you can be crystal clear on what might be happening with your body. This is a fantastic tool for making sure that everything's working right. Because saying, "Oh, I'll remember that," is ridiculous, because we don't remember anything. We like to. We pretend that we're going to remember everything, but I'm still looking for that one book I hid for myself, right? Like, that kind of stuff. So writing things down and having it organized in a medical binder is an excellent tool.
And it's also a fantastic way to advocate for yourself, as Tanya was saying. One of the things that we try to teach young people, like really young people, is that they should always be seeing a doctor once a year, whether they need to or not, because having a physical often it does provide a baseline. And so if you do it once a year, when there are changes that you actually may not be feeling, that there may be no symptoms, then, and you've got them in the binder, you can, like, literally the doctor will flip through them and go, ooh, there was a change here. You may not know that there was a change, but he, reading blood tests and scans and ultrasounds and so forth, can know that there's a change. And we all know that the earlier things are detective, the more treatable they are. And so the younger you start having that once a year, you may never see him any other time. You may be the picture of perfect health, but having that once a year checkup and being able to put it in your binder and or whatever you're going to use, and then allowing him to see that when all of a sudden maybe you're not feeling all that great, or just tracking it can pick up on those changes. And that's really important, especially nowadays when we have so much more at our fingertips to use to control disease. But if you don't catch it until you're in stage 3 or stage 4, it's much harder to treat. And so we try to help young people understand that this is really an important thing. And then just continue on with life, you know? So there's just multiple uses for all this. And it doesn't matter whether you're doing it on behalf of someone or if you are the someone that's doing it for yourself. The binder is really, really important, and has, I think, saved both Tanya and I quite a few times from different perspectives, in moving forward more quickly because we have that evidence that we can advocate on. It's there in black and white. Somebody else wrote it. There was a specialist that wrote it. There was a psychiatrist that wrote it, and so forth. So it now takes on a different weight when it's professional to professional. And so, but it becomes much easier to advocate for yourself when you can say, no, I've got the papers right here. You can look at them, decide for yourself. Just a really important and different way of looking at things.
Yes. And if you end up with a diagnosis that is like a cancer diagnosis, you're going to have a whole host of additional doctors that you're now going to see. So having a well-regulated, organized binder so that you can take it. I had a gynecologist, then I had the gynecological oncologist, and then there was the radiation oncologist, and now there's three people looking at my hoo-ha instead of one, and everybody needs to know what is going on. So here's the binder. This is what happened at my last exam. This is what's going on. And in this day and age, when you have urgent cares and stuff like that, so you don't necessarily go see your regular provider every time you have a thing. When you do see your regular provider, you could be like, well, I went to urgent care for this bee sting, and over here I had a yeast infection or whatever, right? Or I needed penicillin because I had strep throat or whatever it is. Now, their record for you can be updated with that information.
That's right. So are there any other questions at this point that we can answer?
Not so much of a question, but I just want to say, like, having a medical binder, especially for when you're a caregiver, is such a great idea because I'm a caregiver for my mom. And before COVID, I would go with my mom to her appointments. And then when COVID got really bad, the doctor wouldn't allow me to be in the room with her. So it was so frustrating, quite annoying, because I couldn't be there to hear what the doctor had to say or to express to the doctor, like, hey, this is going on with my mom. So having a medical binder for my mom, because she has a hard time speaking up for herself. She does have a disability. So collecting all that information and gathering it for a binder and just giving it to my mom to take with her, I think that's such a phenomenal idea. I think it would save also a lot of time and frustration and lack of communication as well.
Yes, yes. And I know that there are apps out there that are HIPAA compliant where you can actually record conversations with your doctors. And in some states, I don't know what goes on in Canada, but in some states, they're one-party states, so you can record any conversation that you're a part of. Um, Here in New Jersey, that's a thing. I can record whatever conversation I want as long as I acknowledge that I'm recording, right? Like, and I'm participating in the conversation. So, as somebody with either dementia or chemo fog, not being able to remember what the doctor writes can be exceedingly challenging, especially in a situation. I mean, I can't even imagine having to have gone through any of that during COVID. That just, scares the pants off me. It was hard enough writing stuff down with chemo brain, and during, like, while the doctor was actually talking to me, I still had problems, and I, ooh shiny, and only got half the stuff down, but it was still important because there were still lab tests and reports and all of that stuff that went along with it. Yeah, it's a very good point, Audrey. Like, I Jennifer, when she found out that I had one, she was like, "Oh my God, somebody else does that," and I was like, "Everybody does that, right?" And she was super surprised. But that's what birthed this whole, like that little conversation between the two of us birthed this, and I was like, you're right, that's a thing that needs to happen, so we need to make it accessible to more people, which is why we did.
Absolutely. Absolutely. And um anybody that has, well, dementia, of course, and I work with dementia, so I could speak for that for hours. But anybody that has a brain injury, a learning disability, poor working memory, so that takes in a lot of young people. And then also as we age and we start just having regular forgetfulness. It doesn't even have to be like a thing. It doesn't have to be senility. It doesn't have to be dementia. But just as we start to age and start forgetting things that only come up at 3 o'clock in the morning or after you've already left the doctor's office. I know because I do it all the time. This starts to provide just a way to have communication with the doctor, or just a way for you yourself to remember exactly what he said, not partially, but exactly what he wants you to do, where he wants you to go, what type of medication he wants you to take, any questions that you might have, how did he answer them, um, and when your next appointment is and why you're having a next appointment. So all of those things are there at your fingertips. But especially as we start to forget things or our brain is not working properly for a variety of reasons, we can't expect those people to ask the questions, to remember them, to uh, even come up with them in a doctor's office when they're by themselves. It's a little trickier in Canada um, to get over that hump of confidentiality. We're working on it, but it's very tricky. So and recording is not really allowed. You have to prepare and let your doctor know, and he's got to approve it and everything long before you have that appointment. So it's tricky. So this is a really good way just to have all that information at your fingertips, regardless of the reason that you can or cannot remember um, what you were going to say or what you need to ask or questions that you need to think about while you're there. And then he can write them down. And then everything works just much like a well-oiled machine.
And to that point, there's always the I need to ask my doctor this, I need to ask my doctor that. I have this whole list of questions I need to ask my doctor. And then you get there and you don't ask them anything because you forgot your entire list of questions because you didn't write it down. So you, as you're going through your regular day, be like, oh, I have to ask them this and jot it down so that when you're there, you have this list and then you can get all your questions answered. Marissa, you had your hand up. Did you have a comment?
Yes, I had wanted to say two things. First of all, I have to say bravo to you because you have the back of the binder where you have those folders that you can put things in. And I had just wanted to bring up the fact that I've actually had personal experience where the written report from any type of film may not have sat well with another doctor. And I've actually had two doctors say to me, that report is only as good as the radiologist who read that. So the film is something that they want their expert to actually look at. So if you have it with you, you just hand it over and they stick it up and they look and they have their rendering of what they see. So it's almost like their seal of approval on it. So I really think that that's a fabulous idea in the back that you said you had those like pockets for that type of stuff. And the second thing is that even though we have all this technology nowadays, and in the United States, we have the patient portal and you're supposed to hook up to the patient portal, but not every doctor is in the same, it's become a business nowadays, and it's a corporation and a doctor gets a paycheck, and not every corporation is in the same patient portal. And when the doctor only has so much time, the binder, like you need that physical binder to go with you. There's no, whether you have a child, whether you're a caretaker of a parent or a sibling or a child that has issues, or you have medical issues yourself, if you don't have that physical binder, there's really nothing you could do. You can't collect all that data on all those different patient portals, and you can't get it to the doctor, to your primary. You can't get him everything because sometimes those systems don't fit in. So I think this is just a fantastic idea, this physical form that you take with you, and everything. And he or she only has so much time. And just the other day I went and they're like, when was the last time you had your eyes tested? So, I had my papers and I looked the papers from the last one and I looked it up and there was the date. And then he writes it down because he doesn't have time for me to flip through or I'll call you back, or there's no time for that. So it really is like fabulous to have this physical thing.
You make an excellent point, Marissa, with that patient portals. But one of the blessings of having patient portals is you have actually so much more access to your medical records than you did previously. That you'd have to go in and you'd have to pay the doctor's office to print off a copy of your records. Now you can look after the appointment, they'll upload it, you'll get the report, you'll get their notes on it, and then you could just print it off, stick it in your binder in their section, and know for next time. Stella, did you have a question?
No, I just wanted to share something, but go ahead.
No, you can share, absolutely.
I just wanted to say how useful would be if I had for like every summer, I would send some of my kids in Europe. And one time my little one was he had an insect bite, and they call me during the night at 3 o'clock in the morning because we have 7 hours difference, to ask me if he is allergic to something. So if he had this, Mom, I'm talking. If he had this binder with him, they didn't have to wake me up at 3 o'clock in the morning. And I was like, if they calling me, it's an emergency. So I was all shocked and stressed out. And if they had it, even in English, they would be able to read it because it's in Latin, So would be great, very useful. Thank you for doing that. Yes.
Yeah, and you can do an abridged version for trips where you just copy certain pieces out of it and you send it with your kid, tuck it right into the little passport bag, whatever they're holding their passport in, put all their little medical records and the medical POA who's allowed to make decisions, all of that in one beautiful spot. That's an excellent point.
Another thing I wanted to share, that my husband was he was fixing the garage door, and actually in state of Georgia, there dead cases. The spring came out and hit his hands and broke his bones, and it was totally yes. But just because when the ambulance came, I wasn't here. He wasn't able to talk because he was in such pain. But they smelled that he smelled like alcohol, and he drank just one beer, and just because of that one beer, they didn't give him painkillers because they were not sure how much he drank. So after an hour, I went in the emergency room. He was still in pain, and they still didn't give him any painkiller medication, just because I wasn't there to tell them, and they didn't have my information. If I had, like you say, on the refrigerator information with my phone number or something, they would be able to call me and ask what is going on. He wasn't able to speak for himself.
Yes.
So all those tips are just,
Yeah.
everything is so useful. Thank you for doing
You're
that
welcome.
for us.
We absolutely take for granted the fact that we can talk and then we can articulate what's going on right now. In a medical emergency, that's not necessarily the case. And putting an ice notification on your refrigerator and in your car, that was a great idea. I hadn't thought of that, but definitely they're not going to go searching glove box, right? Sticking it right there. But you want to make sure that you don't leave it in there when you're not in your car.
This is true. But that also brings up the point that your binder can be that's the place everything goes. But Tanya, you made a really good point about when you're sending your kids to camp or to Europe or whatever, you just pull out the necessary pieces. So that would apply to everybody. If you're going to, a specialist, let's say, let's just use dementia. If you're going to a dementia specialist, you do not need to be taking all your gynecological, if you're a woman, pieces with you, because that won't have, at least at this time, it doesn't correlate to dementia. So you literally can take out the pieces that you need, or leave the pieces that you need in the binder, and take out the stuff that is not appropriate. So for my daughter, at this time, being 21, over 21, she doesn't need to take her kindergarten records with her. She needs to take her immunization records with her. She doesn't need all her school stuff unless the appointment is pertaining to some type of WISC or intellectual test or so forth. They don't need that information. So
Yeah.
it's not like you have to carry a big binder around. That's kind of your mainstay where your information is. And if it stays in the same place all the time, and your spouse or your relative or a trusted friend knows where that is, then in an emergency or in a crisis, somebody will be able to go and get that information and take it with you.
Yeah.
And I think that's really important, to have something all in one place. Now, outside of binders, I'm just going to tell you guys one thing that I learned a long time ago. And that is all important papers that you have, like insurance papers and medical papers and POAs and everything, should be put in a freezer bag, double freezer bag, and stuck in your freezer, like in your fridge freezer, because that is the first place that firefighters will look for information if it's not on the front, because generally freezers and fridges are the last things to burn. So if your house is on fire, they can get your medical information if you leave it in the freezer.
Interesting.
Just a tidbit.
Okay. All right.
So, yeah, but I think we
Audrey
have
has
a
her
lot.
hands up.
Yeah, just before I'll let you do that with Audrey, but I'm just gonna say, I'm gonna put my stuff in the chat so that you can look at it. And if you have any questions, then you can just let me know.
Okay. All
Go
right,
ahead,
Audrey.
So starting a medical binder for myself, how far back should I go when starting my medical binder?
As far back as you can.
As far back? Okay.
Yeah, because you don't know what is in there that might be a key indicator for whatever the provider is looking for. So the more complete your story is, the easier it is for them to find differences, right? Like,
Mhm.
you know, you definitely want to go back as far as possible with your immunization records. You're going to want to go back as far as possible with your surgeries, because every time you go in to have a surgery, they're going to ask you, what other surgeries have you had? So if you
So,
already have it in there, you don't have to go hunting for that information. Oh, I had my adenoids taken out when I was, I don't know, 7.
mm,
You can just
yeah.
look it up. This is the date of the surgery.
So also in the medical binder, should I also like put stuff like for my eye exams, maybe when I went to see the dentist, that those kind of things I should also include?
Yes, and the reason that I say that is your mouth is super important. Infections in your mouth can kill you, right? So like dental work, having that information is a necessary thing. Your vision, I'm not so sure about, but I would just include it. I would include the vision, the dentist. I would include elective procedures. I would include anything that the word doctor is involved in.
Good to know. Thank you so much.
You're welcome. Anybody else have any questions or comments? No? Okay, fantastic. All right, well, I think I'm pretty good here. Like, any final thoughts, Jennifer?
No, I think I'm pretty good too. But Audrey, I need you to tell me why this link. Can you click on this link? Because I can't from my end.
No.
I
I
couldn't
can't either.
I couldn't click on it, but I copy it and paste it and send it to myself. And that's how I opened it.
Oh, so it did open? Okay. I don't know
Yes,
why.
it opens. Just
I don't
copy
know
and
why.
paste to yourself. I send it to myself as a message.
There you go. Audrey's got it. Perfect.
Fantastic.
Awesome.
All right, well, if nobody else has any questions, thank you for joining us. We really appreciate your time, and we hope that these resources really help you and your families.
Thank you, ladies. It was wonderful.
Thank you. We appreciate you. Thank you.
Yes,
Thank you for
welcome.
sharing this. It's a great tool to have, and I appreciate all your work towards this. Thank you, guys.
You're welcome.
Thank you.
Jen.
Thank you. Have a good night,
Have a
everyone.
good night, everyone.
Good
bye
night.
everyone.
Bye. Good
Bye.
night.